The world is in the grip of a silent epidemic, a crisis that knows no borders, respects no age, and shows no mercy. It is the global drug crisis, and its deadliest weapon is fentanyl. This synthetic opioid, 50 times stronger than heroin, is leaving a trail of devastation in its wake. From the bustling cities of North America to the remote villages of Southeast Asia, fentanyl's reach is vast and its impact profound. This is not just a story of addiction, it is a story of loss, of families torn apart, and of a future held hostage by a relentless enemy. This crisis demands our attention. It demands our action. We can no longer afford to remain silent while countless lives are lost to this deadly epidemic. The statistics are alarming. Overdose deaths have skyrocketed in recent years, reaching unprecedented levels. In the United States alone, over 100,000 lives were lost to drug overdoses in a single year. The human cost of this crisis is immeasurable, leaving behind shattered families and communities grappling with grief and loss. The grip of this epidemic is tightening, threatening to ensnare even more victims in its deadly embrace. We must act now with unwavering resolve to stem the tide of this crisis and offer hope to those who have lost their way. Fentanyl is a ruthless adversary. It is cheap to produce, easy to smuggle, and incredibly potent. Just a tiny amount, equivalent to a few grains of salt, can be lethal. Its potency is what makes it so dangerous, as even experienced drug users can fall victim to its deadly effects. Fentanyl is often laced into other drugs, such as heroin, cocaine, and methamphetamine, without the user's knowledge. This deadly cocktail increases the risk of accidental overdose, as individuals unknowingly ingest a lethal dose of this potent opioid. The unsuspecting user, seeking a moment of escape or relief from pain, is met with a fate far more sinister. The allure of a quick high becomes a dance with death, a gamble with the highest stakes imaginable. While the drug crisis affects people from all walks of life, certain demographics are disproportionately impacted. Young adults, between the ages of 18 and 45, are particularly vulnerable. Their lives cut short by a crisis that has stolen their dreams and aspirations. Minority communities, already facing systemic inequities, bear a heavier burden, with Black and Hispanic populations experiencing higher rates of overdose deaths. The reasons behind this disparity are complex and multifaceted, rooted in poverty, lack of access to healthcare, and historical trauma. These communities often lack the resources and support systems needed to combat the drug crisis effectively, leaving them vulnerable to the devastating consequences of addiction. Behind the statistics are real people. Sons and daughters, mothers and fathers, friends and neighbors, all lost to a crisis that does not discriminate. Their stories are a stark reminder of the human toll exacted by this epidemic, a price paid in pain, suffering, and shattered lives. Section 4. A World Entangled. The fentanyl crisis is a global problem with complex supply chains that span continents. Mexico has emerged as a major production hub for fentanyl destined for the United States. Mexican drug cartels operating with ruthless efficiency have capitalized on the demand for synthetic opioids, flooding the market with their deadly product. China, while not a direct supplier of fentanyl itself, plays a crucial role in the crisis. Chinese chemical companies are the primary source of precursor chemicals used to manufacture fentanyl. These chemicals, often legal in China, are shipped to Mexico and other countries where they are used to produce fentanyl in clandestine labs. The fight against fentanyl is a transnational challenge that requires international cooperation. Governments must work together to disrupt these supply chains, target the criminal organizations profiting from this crisis, and address the root causes of drug demand. Section 5. A Glimmer in the Darkness. Despite the bleak outlook, there are glimmers of hope. Communities around the world are fighting back against the drug crisis, implementing innovative programs and policies aimed at harm reduction, treatment, and prevention. Naloxone, a life-saving medication that can reverse opioid overdoses, is being widely distributed and administered by first responders, saving countless lives. Support groups and community organisations are providing a lifeline to those struggling with addiction, offering counselling, peer support and access to treatment resources. These initiatives, while often underfunded and understaffed, are making a difference, offering a beacon of hope in the midst of despair. The fight against the drug crisis is far from over. It is a battle fought on multiple fronts, stemming the flow of drugs, providing treatment to those struggling with addiction, and addressing the underlying social and economic factors that contribute to drug use. It is a battle that demands our attention, our compassion, and our unwavering commitment to finding solutions.